Okay, this is your final study in forensic psychology for this year. So the final study is about treatment for offenders, and they're looking at ear acupuncture for drug rehabilitation. Very famous model, Kate Moss, famously had this treatment, acupuncture, for her drug addiction. So it's a well-known sort of not cure but a way of curbing cravings for drugs. And it's a sort of bit of a passive one, because what they've noticed is that one problem with the CBT or any other sort of treatment with offenders is that you have to be quite strongly motivated for the programs to work. And unfortunately, the motivation seems to be in short supply in prisons, particularly among the hardened drug users. So one solution has been to turn the wisdom of the East and the ancient Chinese technique of acupuncture and start using it in the prison system. However, it was used by models like Kate Moss, and that's probably where they got the ideas from, because it was working on the elite. So there are 5 locations that particularly linked to junk problems. So 5 locations in the ear which can help the flow. So as part of the treatment, needles are inserted into these points in the ear. The standard is that they're left for 40 minutes, during which time the patient sits quietly without speaking. Between sessions, patients can have acupressure balls placed on the acupuncture points to keep them stimulated, and these are usually seeds, pellets or tiny ball bearings held in place by a sticker, so the pressure's still there even after the needles have been withdrawn. Now, Mike Wheatley, he studied 350 prisoners in 6 high security prisons. So high security, these are your aggressive re-offenders, so they're quite well-known criminals, if you like. The prisoners were all receiving drug counselling services called Focus, and some of them were receiving ear acupuncture at the same time. Now, this group were compared with a group who just received the focus counselling. So we've got 2 groups. We've got a control group, focus counselling, and the experimental group who's having focus with ear acupuncture as well. So we're looking at the balance now for the strengths and weaknesses. Will this work? You're looking at placebo effect. All these factors come into the use of this treatment. So, as we said earlier, there are 5 acupuncture places in the ear, and each offender on the programme had this treatment, 40 minutes relaxation. The results from this, they collected qualitative and quantitative data. So the qualitative data were the offenders reported better sleep patterns, they were getting more rest than before. They had improved relaxation and they felt better able to cope with situations. They had reduced cravings for things like nicotine and obviously drugs, so they shouldn't really be able to get them in the prison system. The quantitative results show that there was a 70% reduction in drug-related instances within the prison, 41% reduction in serious instances within the prison, and there was a 42% reduction in positive drug tests. There was also a reduction in positive drug tests which were voluntary, so 42% mandatory drug tests, so they had to have them, and the others were voluntary, and both of those drug testing showed a reduction. And the reason you'd volunteer for drug testing is if you want to go on parole. So it's a short, sweet study, and the conclusion is that Wheatley believes that this is significant evidence for its use in a prison system. So he's got a large sample. He's shown that combining focus with ear acupuncture is a way of improving life for offenders, is a way of hopefully stopping recidivism by getting them off their lifestyle-dependent drug addiction that probably got them in prison in the first place. Okay, that's your final study in forensic psychology.